Medicare provides low-cost comprehensive coverage to senior citizens across America. But there are still costs that you need to be aware of. And we're going to break down those costs in today's video. Hi there, my name is Sarah and welcome to iHealthBrokers channel. Now if this is your first time, please make sure to take a look around because we've got plenty of videos about Medicare, all the different parts of Medicare, and that's what we're going to be covering today. So make sure to stay tuned to the end of the video, that way you get a full picture of all the costs. Of course, if you have any questions whatsoever, you can reach us here at iHealthBrokers at 888-410-0344. There is no charge for our services, so please feel free to give us a call with questions. And of course, we're licensed nationwide. And you can absolutely reach us in the comments below if that's easier. As always, we ask you to subscribe because we do release these videos on a weekly basis. There can be policy changes and of course cost updates in Medicare, and we want to make sure that our clients and our viewers stay informed. Additionally, please make sure to like this video because liking this video will make it more visible to others who are looking for the same type of information. All right, let's get started. Let's start with Medicare Part A. Medicare Part A is part of Original Medicare, and you can consider it your hospital insurance. Generally speaking, Medicare Part A will help to cover inpatient care in a hospital, nursing facility care, nursing home care, hospice care, and home health care. For most people, there's actually no monthly premium for Medicare Part A, meaning you don't have to pay on a monthly basis to keep it active. However, if you're not eligible through yours or your spouse's work history, then you may have to pay a monthly premium. In 2021, if you or your spouse has worked less than 30 quarters, then your monthly premium is $471. If you've worked between 30 and 39 quarters, then your monthly premium would be $259. Once you hit 40 quarters though, if you continue to work, your monthly premium should disappear. Medicare Part A does have a deductible that you'll have to meet. As a reminder, a deductible is the amount that you have to pay out of pocket before any type of cost sharing begins. In 2021, the deductible for Medicare Part A is $1,484. Here's where things can get a little bit confusing. It's not an annual deductible, it's actually applied per benefit period, which basically means per hospital stay. Now let's talk about coinsurance. So once you've met your deductible, you'll be responsible for coinsurance. For each hospital stay or benefit period, you're not going to be responsible for any coinsurance for the first 60 days. For days 60 through 90, you're charged $371 per day. After that, you're what's known as in your lifetime reserves. So you have these 60 additional lifetime reserve days that can only be used once in a lifetime. It's not on an annual basis that they're renewed. If you have to tap into those reserve days, you'll be charged $742 per day. And once you hit that additional 60 days of it, Medicare isn't going to contribute any further. But remember, outside of those lifetime reserve days, those charges are based on the benefit period. It's not on a yearly basis. Now let's talk about Medicare Part B. Medicare Part B is also part of Original Medicare, and you can consider it your outpatient insurance. Generally speaking, Medicare Part B will help to cover doctor's visits, mental health services, outpatient surgery, ambulance services, durable medical equipment like wheelchairs or walkers, and very, very limited prescription drugs such as injections you get in a doctor's office and certain oral cancer drugs. Medicare Part B will always have a monthly premium. In 2021, the base premium is $148.50 or more dependent upon your income, because your monthly premium for Medicare Part B depends upon your income. Now, if your income has gone down, perhaps because you've retired, you can apply for a reconsideration with the form that I'm going to put in the description below. Additionally, there's a deductible that you have to meet for Medicare Part B. Now, this is simpler than with Medicare Part A because it is a once yearly annual deductible, and in 2021 the number is $203. So you have to meet that deductible of $203 out of pocket before the cost sharing begins. At that point, generally speaking, you're going to be responsible for 20% of the costs, and Medicare will cover 80%. Now, of course, you have to see a doctor who accepts Medicare and be receiving services that are covered by Medicare. Finally, you need to be aware of Medicare Part B excess charges. So basically, some doctors who accept Medicare won't accept the amount that Medicare pays. They can choose to charge up to 15% more, and these are known as Medicare Part B excess charges. If you're not enrolled in a Medicare supplement plan that covers these excess charges, then it's on you to pay the difference. However, they're not very common. It's really pretty rare. You just need to be aware that they do exist. Now let's talk about Medicare supplement plans, also known as Medigap plans. So basically, Medicare supplement plans are a type of voluntary secondary insurance that covers the gaps of original Medicare. You're going to pay an additional monthly premium, but it's going to waive or lower your deductibles and your coinsurance. There are 10 different plans with 10 different levels of coverage and price points. So let's take a look. Okay, so first things first, let's take a look at the different Medigap plans that are available. So right now we're on Medicare.gov. I'm going to put a link to this exact page in the description below so you don't have to go searching for it. So I just want to scroll down here, and here are the plans available: A, B, C, D, F, G, K, L, M, and N. And then over on the left side of this table are the benefits, and you'll see if the plan includes the benefit or not, or if there are any asterisks. So like I said before, these plans are standardized, which means that Plan A will be Plan A regardless of your carrier. Plan B will be Plan B regardless of your carrier, and so on and so forth. Medicare supplement plans don't offer benefits that are not basically already offered by original Medicare, so it's not going to offer dental or vision or anything like that, but it's going to help cover coinsurance or deductibles. So here you'll see Part A coinsurance and whether the plan's covered or not. Part B coinsurance, so this would be that 20% that you might be responsible for paying at a doctor's office. So most of the plans will cover that, with the exception of Plan K and Plan L, which will cover a portion of it. And you'll notice that as we continue to go through the different plans, that's basically a pattern. Plan K and Plan L will always cover a portion of it. Here's something important, Part A, hospice care. So remember we were talking about what your coinsurance might be, especially when we are talking about extended stays. So days 0 through 60, there's no coinsurance, but if you were need to stay someplace for an extended period of time, then that coinsurance can get pretty darn expensive. So luckily, most of the plans will cover the entirety of the coinsurance. And then here's that deductible, that Part A deductible that's applied per benefit period. Basically, most of the plans will cover it or contribute to it at the very least, with the exception of Plan A. Now, here's a change. Plan F is no longer being offered to new enrollees, and that was really the only plan. Plan C hasn't been offered either, but those were really the only plans that covered that Part B deductible. But remember, the Part B deductible is only once per year. It's only $203, so it's not that big of a change. Then there's Part B excess charges. The only plans that ever covered that were Plan F and Plan G. Plan F is no longer being offered, so if covering Part B excess charges is important to you, then you need to go with Plan G. And then even you'll see that some of the plans offer foreign travel exchange. And because most of the plans basically are going to cover all of your expenses, this is not applicable. The only ones that don't cover all of the expenses are Plan K and Plan L. And remember, that's because there's that cost sharing aspect. But even still, they're going to impose an out-of-pocket limit. So no matter what, you're not going to be responsible for any more than $6,220 for this plan and $3,110 for Plan L. Now I'm going to switch over to another page on Medicare.gov. Here we can locate the plan finder. So I'm going to continue without logging in. And right now we're just going to look at Medigap policies. It's going to ask me for a zip code. I'm going to put in Florida zip code. And then it's going to ask me some more information. So for right now, I'm not going to put in any information because I want you to see something that's going to change when you do put in a little bit of information. So basically, it's going to show me a broader range of prices. So here are all the different plans. We have Plan A, B, C. This plan isn't available if you turn 65 on or after January 1st, 2020. D, Plan F. This plan isn't available if you turn 65 on or after January 1st, 2020. Plan F, the high deductible version, still not available. Plan G, the high deductible version. Plan K, Plan L, Plan M, and Plan N. So while we're down here, let's look. That is a pretty darn broad price range. So here's why I said I wanted you to see what happens when you actually put in just a little bit of information. So let's say I was 65, female, doesn't use tobacco. I'm going to update those prices. A much narrower range. And that's basically what Medicare.gov is going to provide to you. On that other page that we went through, you can compare the different plans to figure out which plan you think will most suit your needs. On the right side of the screen, you'll notice that there's a brief summary of the plan benefits. You can click on the plan details for further information. So it'll show you, generally speaking, your premiums, the deductible for Part A and Part B, and that you won't have any coinsurance. This is only for Plan A, of course. And then it's also going to show you Part A covered services. It's breaking down all of the costs for you, just in case you needed a brief reminder after comparing and contrasting on that other page. Let's actually look at a different plan, though. Let's look at Plan G, which is currently the most comprehensive coverage available. So obviously the premiums are a little bit more expensive. You have a $0 deductible that you're responsible for Part A. You're still going to be responsible for Part B deductible. You're not going to have any coinsurance for approved Part B services. And then look, $0 coinsurance for pretty much anything associated with Part A. Basically, Plan G is going to take out any additional costs. You're really just going to pay for your monthly premium in addition to that Part B deductible. And other than that, there's really not going to be any costs when using your services. So like I said, it's going to provide you a range of prices, and the prices are going to be determined by your carrier. So let's go back down to Plan G. Out of that. Okay, so here are the policies offered in our state. So then what you need to do actually is contact these companies directly, because even though it gives you a range of prices, it's not going to tell you exactly what this company is going to charge for Plan G or what this carrier will charge for Plan G. You would need to contact them directly, which is why we recommend working with a broker. That way they can just walk you through everything much more quickly and you don't have to contact each and every carrier individually.
Then there are Medicare Advantage plans, also known as Medicare Part C. Now, Medicare Part C actually replaces original Medicare entirely. These plans aren't standardized like Medicare supplement plans. The benefits can vary quite widely, as can the prices. So Medicare Advantage plans are probably more similar to the employer-sponsored group health insurance that you've had in the past. You're going to have to give up that extremely broad original Medicare network, and you may get some additional benefits as a perk. It depends upon your area and your needs whether Medicare Advantage is right for you or whether you're going to want to go with original Medicare and a Medicare supplement plan. Now, the premiums can vary quite a bit. Some plans will even boast a $0 monthly premium, but you're going to need to continue to pay for Medicare Part B. Medicare Advantage plans sometimes advertise themselves as free, but they're not really free, so buyer beware. Additionally, there are copays that you need to be aware of. So let's take a look at some of the plans available so that way you can have a better idea of what the price structures are like.
Okay, we're back on Medicare.gov, same page we were on before. We're going to continue without logging in. This time I'm going to click on Medicare Advantage plans. I'm going to put in Florida zip code. Oh, just as an FYI, while we're talking about Medicare Advantage really depends upon your location as far as how effective it is, and Florida happens to be one of the places where Medicare Advantage is a little bit more popular. It's going to ask you if you get help with your costs from any of these programs. For right now, we're going to put, I don't get help from any of these programs, but if you did, for example, a Medicare Savings program, something like that, then you would click on that to make sure you're getting accurate pricing. Also, Medicare Advantage very often offers prescription drug coverage. So, if you take prescription drugs, it's very beneficial in your searches to make sure that you put in that information, because the more information you put in, the more accurate you can be when deciding which plan will best suit your needs. So let's just put in, we've done this drug in other videos, so we'll put in Lipitor. Sure. It's always helpful to put in a generic if it's available because you're going to save money. We're going to add that to my drug list, and that's really enough for right now. I just want you to see how you can compare the different drug prices. We also want to pick some pharmacies. Okay, so let's pick a mail order pharmacy. Always helpful to pick a mail order pharmacy. Let's pick a CVS and a Walmart, sure. Okay, so we have 53 Medicare Advantage plans. Right now it's sorting by lowest drug and premium cost. So here it says a $0 monthly premium. This is what I was alluding to before. Sometimes Medicare Advantage plans will claim that they are quote unquote free. They are not free. No plan is free. You're going to have to continue to pay for your Medicare Part B monthly premium. So it's showing you what your estimated yearly drug and premium cost is. So because there's no additional fee for this plan, and it's looking like your drugs would be pretty inexpensive, it's telling you that it would be $0. A $0 health deductible, a $0 drug deductible. So that means that you don't have to spend anything out of pocket before the cost sharing begins. At that point, you're responsible for copays. And then your max in-network is $2,500. Now that's something that's really important with Medicare Advantage, is this in-network versus out-of-network. Because Medicare Advantage, unlike original Medicare or Medicare supplement plans, you are beholden to a network. So for this one, we'd be beholden to Care One. So your doctor must accept your plan. Otherwise, it's considered out of network. And because this plan is an HMO, if you had to go out of network, there would be no coverage. Additionally, this plan is going to offer you vision, dental, hearing, transportation, fitness benefits, worldwide emergency, telehealth. Let's see what other benefits. Over-the-counter drugs, but it's not going to offer you in-home support, home safety devices and modifications, and emergency response devices. Now, it's specifically putting those here, and it's Xing them out because those are more common benefits offered by Medicare Advantage. It's just making it a little bit easier for you to compare the different plans. And if this was a plan that I was interested in, I could click Add to Compare. It will let you compare up to 3 plans.
And let's just see a little bit further details. So here's your premiums. You still have to pay for Medicare Part B though. Your deductibles, an estimated yearly cost based on what we've put in so far. And you don't have copays. However, look at this. It is telling you, so this is because it's an HMO. Generally speaking, with an HMO, if you're going to visit a specialist, your primary care doctor has to arrange that visit with a specialist. They have to give you a referral. So it's telling you on this plan, advanced plan approval is required and a physician referral is required. Otherwise, they won't cover your visit to the specialist. Here are your copays for tests and lab services. Again, there are limits. Inpatient hospital coverage, so $0 copay. Outpatient might be somewhere between 0 to 40. It's just giving you a rundown of all the different prices and costs that you might encounter. And here's some of those extra benefits that it offers. So it's offering you dental, hearing, vision, so there are plenty of benefits offered by this plan. And it may sound like a great plan, and quite frankly, maybe it is. You really need to confirm with Medicare Advantage, though, that it is helpful in your area with the doctors, physicians, hospitals that you prefer, and since this plan offers dental, with the dentists that you prefer, because since it's an HMO, if you have to go out of network, then you're not going to have any coverage. So here's another plan. This one has a slightly higher out-of-pocket max. Benefits seem pretty similar, but it's entirely possible that maybe this has a broader network. Who knows? So if this was a plan we were interested in, we could click to add this to compare. Now let's just go back up for fun. Okay. You can add a filter for the insulin savings program. So if you take insulin for your diabetes, this might be something that you're interested in because that will guarantee you a 30-day supply of insulin for no more than $35. So let's see that. So the plan that we were just talking about actually does participate in that program. So right now it's only showing 23 plans total. So of those 53 plans that we were looking at, 23 participate in this program. Let's get rid of this. If you're interested in a special needs plan, we talk about DSNPs, which are dual eligibility special needs plans for people who have both Medicare and Medicaid. There's other kinds of special needs plans. So let's see if there are any DSNPs available. Wow, that even broadened our availability. Let's get rid of that. And you can even filter based on carrier. So let's say you have a doctor or a specialist, somebody that you've been seeing for a while that you're very comfortable with, and you have a conversation with them in advance regarding what carriers they accept. Well, then you can go through here and let's say they accept Aetna, they accept Florida Blue, they accept Humana, United. Let's apply those. because you need to make sure, again, I say it, with a Medicare Advantage plan that your doctor and your hospital of choice accepts your plan. So now we can see what plans are available offered by those carriers. Now, if you wanted to enroll, click Enroll, and then click Join Plan. But again, Medicare Advantage is a little bit more complicated than Medicare supplement plans because these plans are not standardized. So the benefits, as you may have noticed, can vary quite a bit from carrier to carrier. You want to make sure that you're getting the right plan that suits your needs, and that can be a little bit trickier with Medicare Advantage. The final part of Medicare that we need to discuss is Medicare Part D, which is your prescription drug coverage. As a side note, many Medicare Advantage plans actually offer prescription drug coverage, so if you're going to enroll in a Medicare Advantage plan, you don't need Medicare Part D. Part D plans are regulated by the federal government, but they're offered by private carriers. So each plan must adhere to certain benefits at a bare minimum. However, they can choose to offer better benefits to compete for your business. Medicare Part D has 4 stages. There's the deductible, the period of initial coverage, the coverage gap, and catastrophic coverage. And each of these stages has a monetary or financial cap that's set by the federal government. However, like I said, your plan can choose to offer you better benefits to entice you. Let's break down some of the general costs before we take a look at the plans. So, as I said, you may have a deductible with Medicare Part D. In 2021, the max deductible that any plan can require is $445. However, your plan may waive that deductible or lower it. Then there are copays. So once you're in that stage 2, which is the initial period of coverage, there are 5 tiers of medication, and each tier has a different copay associated with it. The copay is determined by your plan and carrier. Then we move into stage 3, which is the coverage gap or donut hole. At this point, you'll be charged coinsurance of up to 25% of the drug's actual cost. And then we move into catastrophic coverage, which is stage 4, where you can really only be charged up to 5% or $370 or $920 based on generic or prescription drugs at that point for the remainder of the year. We're going to break this down in further detail. Let's take a look at the plans. And we are back once more on Medicare.gov. So I'm going to continue without logging in. This time I'm going to click on a drug plan, Part D. And I'm going to put in the same zip code. It's again going to ask me if I get help with my costs from any of these programs. I'm going to say I don't. Luckily, since we were just here, it saved our drug list, so it's still putting in that generic version of Lipitor. Let's pick some pharmacies. So we have a mail order pharmacy, and let's keep the same pharmacies that we had before, the Walmart and the CVS. And here are the plans. So there are 28 plans available. It's sorting based on your yearly costs, your monthly premiums, and your drug costs. So this first plan basically is going to have the lowest drug and premium cost. Your premium with this plan is $7.30 a month. And here's your estimated yearly drug and premium cost. So basically what it's doing is it's taking the drug information from what we put in, so that generic version of Lipitor, plus the retail pharmacies that we put in addition to the option of a mail order pharmacy, and it's tallying that up for the year with the monthly premiums for the year. And basically it's saying that it's estimating that we'll spend $43.80. And both of our retail pharmacies are in network. You'll also notice the price is basically the same for the retail and mail order pharmacy. And here's the drug deductible, which is $445, so we'd need to meet that out of pocket before the cost sharing begins.
The next plan, slightly more expensive, therefore slightly higher annual cost. Both retail pharmacies are in network. Now, I just want to scroll down to see where we can get something a little bit different. So far, we're seeing all of the same. These all have that drug deductible, and they're all showing me the same costs here. Okay, so here's our first difference. So this plan has a slightly higher monthly premium, but it's lowering the drug deductible. So basically you have less to pay out of pocket before the cost sharing begins. So that's something that's a little bit different. And here's something else that I wanted to look for. So for this particular plan, if you were to use a retail pharmacy, your costs are going to be slightly higher than if you use a mail-in order pharmacy. And we have a lower deductible. Now let's just look at these plan details. So here's our monthly premium. Here's the deductible with this plan. This is what I was mentioning before. The plans can offer better benefits, so they don't have to charge you that $445 deductible. They can offer a lower deductible or waive it entirely. And then here's some information about the drug tiers. So there are 5 tiers, and with each tier is a different copay or coinsurance. So for this particular plan, you have a $2 copay for tier 1, $7 for tier 2, $35 for tier 3, and then when you're looking at the higher tiers, you have coinsurance of either 50% or 28%. In the coverage gap, sometimes referred to as the donut hole, you'll be responsible for 25% of the drug's costs. You will probably notice your prices increase quite a bit during the donut hole. And then should you reach catastrophic coverage, you'd be responsible for 5% coinsurance or $370 copay, or 5% coinsurance or $9.20 copay. These both happen to be preferred in-network pharmacy. Now, if we had put in additional pharmacies, you might have noticed that the costs might be more expensive at a different pharmacy if it's not a preferred in-network pharmacy, or sometimes the pharmacy is not in-network, meaning that you're not going to have coverage. And it's showing you what your costs are at Walmart and at CVS. So if this was a plan that if we had picked some pharmacies that weren't preferred in network pharmacies, you would see that it would be more expensive to fill it at a different pharmacy. That's always something that's good to know. That way you can save a little bit of money on your prescription drugs and avoid going into that coverage gap because, like I said, the coverage gap, things can get pretty expensive.
So those are the different parts of Medicare and the costs associated. Now, if this sounds overwhelming or if it sounds like a lot of money, there are actually ways to save money on Medicare, and we have videos dedicated to that. I'm going to put those in the description below. And of course, one of the easiest way to save money on Medicare is to work with a broker to ensure that you're picking the right plan and the right amount of coverage for your budget. So if you'd like our help, you can reach us here at iHealthBrokers at 888-410-0344. And don't worry, there is no cost associated with us. If you liked today's video, please make sure to click like. That way we can get this information out there. And of course, subscribe as well to stay up to date on all things Medicare. We'll see you next time. Bye-bye.